Okay, so when we're muscle stripping along a muscle, we're using reinforced fingers, reinforced thumbs. On the back, it's nicer to use a broader surface because you can feel more of the muscles. And we'll just go along until we find a trigger point. I feel a little something here, and we ask, is this tender?
Yep.
And where would you, if I gave you a pain scale of 0 to 10, 0 being no pain at all and 10 like putting your hand on a hot burner, where would you put this as I press on it?
I'd put it at a 2.
It's at a 2, okay. So this I might not consider to be a significant enough trigger point to treat. But if you find something that's at a 2 at this point, go ahead and treat it. If I was to continue to treat this, I would say, does it radiate anywhere?
No.
So I've asked 3 of the 4 questions now. So can I just get you to take a few deep breaths in as I hold a compression on it. Remember, Travell says up to 30 pounds of pressure, and we're just maintaining a static compression. I am maintaining my good body mechanics by reinforcing my fingers. Remember, when we're doing one hand on top of the other, the bottom hand is the guiding hand and the top hand is the hand that creates the pressure. We want to be able to keep the bottom hand somewhat relaxed because that will help us to be able to palpate. When our hands are tense, we can't sense things as well. So the top hand can create the pressure. Okay, Paige, now that you've been breathing for a few rounds, where would you put this on the pain scale?
0.
It's at a 0, so that's great. So now I can come out of this trigger point release. So I'm gonna come out slowly. You would never wanna bounce right out. It can create tension. And then it's very, very important to flush out the muscles at this point. So I'm gonna flush with some massage techniques. You could also flush, again, Travell recommends by using more moist heat. So I could throw the heating pack back on here again. If I had to, I didn't have to use a maximum amount of pressure on that one. It was only at a 2. If I had to use a maximum amount of pressure up to 30 pounds and I really had to do a significant amount of pressure, then I would use ice afterwards. You can use an ice pack, a cold cloth, or preferably an ice massage. So you'd have a bit of ice around and you would do the ice massage technique just as you learned in hydrotherapy. So that is a complete Travell treatment. Afterwards, for home care, I would recommend that Paige do some active range of motion to treat this muscle. So I would get her to probably move her arms, make sure she's retracting her scapulas and getting some movement in here. She could also stretch by sort of stretching the upper back. But movement therapy and active range of motion would be really applicable in this instance. Yeah.